fit in here, right? Can I just leave it there?
Just
Will it
hold
work?
it. Yeah, you can hold it, Mayor.
I can hold it?
Yeah.
It's a little awkward, but okay. Let me just say thanks. Really, thank you very much. And I know the sponsorship initially came to the state of Connecticut, but and I know you had an awareness last night. You gotta gently shake my hand. I took my brace off, and then, by the way, my doctor sees this on the news, and I have my physical therapy gonna have my head because otherwise I can't put a jacket on. I couldn't wear one for the police class the other night. But this is very important, and we know this is the awareness this week nationally.
Yes.
With regards to the challenges. Certainly, as the chief's articulated, I'm sure he'll do more, or tell us more, Nancy, you could in a minute, about the challenges we have just in the city of Bridgeport, but statewide, nationally. And I know there's reasons for this, but regardless of the reasons, this is where we are as a society. And it's with this type of contribution, this type of donation, this type of awareness, and first responders that can make a difference in saving lives. So we as a city are saying thank you very much. Every dollar is important to us as it is to every organization, to you, and I know to the state of Connecticut. I even saw, I think the U.S. Attorney had an op-ed in this week. So everyone's trying to really focus on this epidemic problem. And I couldn't even pronounce this probably a year ago. So that shows my level of awareness. But unfortunately, we've all got educated even just in the last few moments dramatically. So, Nancy, you want to say a few words about what you're doing and how we got here?
Yes. Thank you, Mayor. Good morning. My name is Reverend Nancy Kingwood, and I'm a Deputy Director of GBAT. And we are in partnership with RNP. This is the RNP staff. We're the contracted site for syringe exchange through the state of Connecticut Department of Public Health. And so because we are the contracted site for syringe exchange, we are also their contractors for Narcan distribution in the city of Bridgeport and beyond. And recently we looked at our data, and we have about 814 clients that access the syringe exchange program. We've only had the contract for about a year and a half now, and since then we are 300% over the number of the former contractor. And so I think it indicates the rate of use of heroin and opiates, not just here, but as the mayor referenced, throughout the state of Connecticut and nationally. And so it was a pleasure to enter into a partnership with the city, because at the end of the day, it's about saving lives. And we do know syringe exchange can be political, but when we look at the rate of increase, that we all come together as a community to develop strategies on how to move forward and how to, just like I said, how to save lives. Thank you.
Thank you. Chief, I know you had some words to add on behalf of the department. Love to hear from you.
Thank you, Mr. Mayor. The fire department's always thought of big building fires as saving lives, and the important fact here is that the firefighters are out every day responding to heart attack victims with defibrillators, delivering babies, and now with this, we're out every day, unfortunately, dealing with heroin and opiate overdoses. We're going through about 1 to 2 doses a day, which Reverend Nancy became aware of and approached us with this great donation. So it allowed us to expand our capabilities and get more Narcan into the end users, which is the firefighters in the field. So we're out saving lives in every way possible. We do everything we can to affect a difference. As the mayor pointed out, this isn't a city issue. This isn't a big city problem. This is happening in small towns. This is happening all over the state. And anything the Bridgeport Fire Department can do to help people and save lives is always our primary mission.
Chief, just quickly, one statistic, if you could give them the number of calls you're getting on this a day or a week or a month.
We respond to, the fire department responds to about 17,000 calls a year. We do about 35 emergency medical calls a day citywide, and unfortunately we're using Narcan almost about once or twice a day. So that's once or twice a day that just the firefighters are bringing somebody back from the brink of death and saving their life. This is above and beyond working in conjunction with the emergency medical service, EMS, and the medication that they carry on board. So this is first arrival, the fire truck getting there first, the firefighters recognizing the signs of a heroin overdose and literally bringing back these people from the brink of death.
I know the police chief's here. I know he had a couple words he wanted to add as well. Chief?
Sure. Thank you, Mr. Mayor. I just want to say that, we got to be aware, okay, how people become addicted to these drugs. It's particularly heroin. It's very addictive. Oxycontin, a lot of people are prescribed this as a pain medication, and it's very easy because what you're taking is synthetic heroin, pure and simple. And I know many people, good people, all right, that have been became addicted to this drug. After a while, they can't get it prescribed anymore, and they turn to heroin. And now, the real danger is the fentanyl that's out there, because these people, they don't care. They just want your money. They'll sell you anything. They'll inject themselves thinking that it's heroin, and it's not. It's pure fentanyl. So I just want to thank you, Nancy, Reverend Nancy, for what you're doing, Chief Dahl. It is a tremendous, tremendous job. Thank you for for helping the police department and the good city of and the good people of the city of Bridgeport. Thank you, Mr. Mayor.
Any questions? I mean, you can do it formally or informally, any way you want. Go ahead.
I just want to know if there's any evidence or any numbers or stats that might reflect how many people might be saved from the Narcan and then therefore go through maybe rehab and get better altogether.
We can probably get those stats. We don't. Nobody readily has them. We don't want to give you the wrong numbers. So,
Mayor, can you talk a little bit about what does one dose of Narcan cost? Or maybe Nancy?
yeah, no, I could only because she told me. Because I asked, and I was told two numbers, but you said it could be as low as $40 or $45, but I've heard as high as $70 or $80. So it's not insignificant. I mean, it's not huge, but when you start thinking of the number that go out on a daily basis, and this was 400 that was provided, you can do the math on that. It's a great help. I mean, look, we wish we didn't have this problem, but the fact is we do, and I don't say just we. When I mean the city, I mean the city, the state, our country, and we know the reasons, and the challenge is there. But when you see organizations, Nancy, like yours, our fire department, the state of Connecticut, the federal government, and all local officials kind of not only raising awareness but doing something about it, hopefully we can not only save lives, as the chief said, but get awareness out there, that, as Chief Perez said, that this is something that we need to really think about. Even people that have medical conditions. Look, they give you, for my arm, they give you pain medication. You just made the connection between whatever they give you, prescription drugs and heroin. And so this is not something that happens, to a select group of people that we don't associate with. It's anybody and everybody, and not that would make it any less of a problem, but it's pervasive, and everyone's life is important. So, and I like the fact that, as you pointed out, that this isn't a syringe, that you can do it with nasal. I'm sure that makes the whole experience, as terrible, as troubling and as life-threatening as it is, a little better of a situation, whether it's a family member who's not medically trained, whether it's a friend, or whether it's a first responder with all the medical attention and training, to be able to say, hey, look, we're going to do this with I guess it's inhaling as opposed to injection, makes it, I would think, a world of difference at that moment. So
I would like to also add just one thing, Mayor, that Narcan only responds to opiates, that it does not respond to other drugs. So if someone is injected or inhales Narcan and they don't have any opiates in their system, the Narcan will just sit on the brain. It will not respond. And so people from the community, whether they're parents or just folks from the community, if they give someone Narcan, they cannot be held legally liable because it falls under the Good Samaritan policy.
of course.
I also just wanted to point out that one of the top priorities of my command staff has been finding alternative ways of funding and alternative ways of getting equipment. We researched, and there are programs, for example, the pharmaceutical company that makes the injector has a program, a community outreach program, where they will donate Narcan and the delivery apparatus to fire departments and police departments. We reached out to them. Due to overwhelming demand, they were out. We've reached out to other organizations that, due to overwhelming demand, could not help us out. And actually, that's how Nancy found out about us, and we found out about her, was that we were looking under every rock and shaking every tree, trying to get, as we always do, try to get the best equipment and the most things we can. And that's how this cooperation came about.
I get you out of the heat, okay? Good. Do you want to do sidebars or anyone feel?
Do you want to?
Yeah, back in June, they had the one night where 20 people overdosed too. Has the city done anything around that after that to make it safer for people and just for response time and stuff like that, supplies? Has the city done anything as sort of reaction here to that?
The New Haven case, and we find this happens here, and Chief Perez can echo this. Heroin it's not made in a pharmacy. It's made in a dirty street lab, clandestine lab. So the materials, it's never the same thing twice. And laced with fentanyl, laced with all sorts of things. So basically, what we call a bad batch hitting the street. And very often, as was the case in New Haven, a bad batch will hit the street and we'll have a huge spike in heroin overdoses. The police department will see it, EMS sees it, and we see it. So it's not something that the city agencies can get a handle on. It happens in a wave. All of a sudden, 5 or 6 companies will go out throughout the city on heroin overdoses, and the different firehouses will call each other and say, hey, did you have one? Yeah, we just had one. And sure enough, through the police investigation, we'll find that very often it came from the same source, and it'll kind of just hit the city in a wave.
Chief, will your officers, is there an exploration going on about whether or not to have them carry Narcan?
Well, 2 parts to that question. Let me just add to what the chief said. The DEA is working in conjunction with the Bridgeport Police Department, and they're very hot on this issue. So that's something that I just want to put out there, that it's not being ignored and that it's treated as a priority by not only the Bridgeport Police Department, but the DEA. The second part to your question, right now we're exploring it. Here in Bridgeport, we're fortunate we have the fire department, and we have AMR, who usually have it, so we don't rely on it. So yeah, it's a possibility in the future, but right now we're just exploring.
Chief, do you want to hold up one of the kits and sort of explain how it
I'll
works?
get one of them whole big the red bag, like this here. Probably be,
Explain how it works.
Just go right in the middle.
You want to explain from the family's perspective?
Yeah, maybe that would be good.
Sure.
One more minute.
Sure. When we give out the kit, we give out kits like this, and this
Look,
comes
microphone.
again directly from Department of Public Health, and we give out actually 2 doses, and it also comes with alcohol and gloves and with instructions. The instructions are right here, and again they go through like a 10-15 minute training. They have to watch a video. This is a Wilda. She's on the syringe exchange program, and she does the training. We actually do the trainings on the van as well. So when people access the van to come, because it's just not about exchanging syringes. We also try to promote treatment. We also talk about harm reduction, and we also talk about safety. We talk about wound care and things of that sort. But again, this is just part of a continuum of care. I don't know if you all want to add
Anyone
anything.
Just
If you could hold it yourself and say my arm.
Could you step over by the podium? Thank you.
Just to add a little bit more from what Nancy said, we're a recovery network of programs. We couple with GBAP, and we're on the van daily. It's our job also to encourage our clients to seek treatment. So we have a Wilda on the van. If anybody at that time needs detox, where I'm called or our detox is called, and we get them right in. We get them into methadone maintenance, we get them to residential. So it is definitely, we're providing the syringes and we're providing the Narcan, but we also are providing them with the treatment. Wherever we can get them in, whether it's a shelter bed or it's residential, they definitely are getting treatment as well.
What is your name, ma'am?
I'm Carolee Peruta.
Can you spell both names,
Sure,
please?
it's Carolee. Last name is Paruta.
Paruta. Okay. And the name of the organization?
It's Recovery Network of Programs.
Recovery Network. And these donations, Mayor, where did the donation of these 400 doses come from? Was it from the state or?
Correct.
Yeah, it was.
It was from
Nancy
the
can
Department
tell
of
me.
Public Health.
It was, okay.
Yeah, and they just
Sorry.
They distribute through their contracted sites. So since we have the contract for syringe exchange, it's a good marriage to distribute through the syringe exchange programs. Mhm. And I also want to mention the van is out five every day for 5 days, Monday through Friday.
Different locations around the city?
Yeah, we're primarily at Merton House, and then we go to Jane and East Main. And we also have a new site at through the Mount Airy Development Corporation at 105 Frank Street.
Perfect.
So we're there on Mondays from 4 to 6:15.
That's great.
Yeah.
That's great.
Anyone?
Chief, do you want to just real briefly explain the training that they get? You know, what are you going to be doing with these kids and the training that your firefighters get?
As Nancy pointed out, these could be given to civilians that are covered under the Good Samaritan Act. The firefighters are trained. Some of our members are EMTs, emergency medical technicians. All of our members are EMRs, emergency medical responders, state certified. The application of this medicine is within the course of their training. That was one of the delays that once Nancy came forward that we had to just double check that this was within our scope. We were already administering Narcan, but to be able to accept it was, we just wanted to make sure that that was okay, which it was, and we are very relieved that the firefighters now have this, in the scope of their training, they can administer this medication.
Chief, can you tell me percentage-wise from last year to this year, how much you're up in terms of the usage of Narcan in the fire department?
I would say that we were probably once every other day last year,
okay.
and again, as I pointed out earlier, we're probably 1 to 2 times a day now. So it's definitely a 75 to 100% increase.
Yeah. Thank you. Thanks, everybody,
Thanks, everyone.
for doing this.
You're welcome to. Let him go to shade though if you need Nancy or the chief or anybody.
And don't shake his hand.
Yeah, whatever.
Yes.
you do. Just